Hello everyone, my name is Dr. Asthma and I'm a specialty registrar. I joined NHS as an international medical graduate, and in today's video I want to discuss about clinical audit. The aim of this discussion is that by the end of this video you should be able to understand audit process clearly and able to explain it to somebody, and most importantly you should be able to go and start your project yourself. So in order to start, we should know why it is so important. Basically, it is an essential requirement for a doctor to be able to do an audit, while it's one of the necessities of your job. Secondly, it is part of the essential requirements in the specialty training application, and it gives you an opportunity to show commitment towards your specialty if you have targeted your clinical audits towards a specific specialty. And for a candidate to score higher, you should be able to devise the audit and design it and be able to present it. So let's get started with the definition. Clinical audit, it is a quality improvement cycle which involves measurement of effectiveness of care against standard criteria. So basically there are two things: one which is already established criteria for a clinical practice, and this is a standard, and one which is happening in the trust, in your job, in your practice. So basically you're comparing the two standards, and by comparison you're finding gaps and you're evaluating your service provision. This is a continuous process, and by the end of the audit you should be able to pinpoint your recommendation and then re-audit after the implementing the changes. It sounds very wordy, but actually it's very basic. It's just as you open a guideline and it says that asthmatic patients should have an annual review of their medication. And then you just go and in your practice, if you see many asthmatic patients and you're not, and on giving the history you're not sure that they have been reviewed frequently enough, you have found a gap, you can probably go and propose your audit as that this is a gap that you have found and you want to do an audit on it. I will explain it further by step. Now I am explaining how the audit cycle works. So let's see this diagram which helps you, which tells you to understand the whole cycle very easily. There are 5 steps. First is identification of a problem. Second is that you know the set criteria and standards, and then you observe the practice, and between the set criteria and what you have observed you find the gap. Now this gap, in order to show this gap, you have collected a data, you change this data into spreadsheets, and then come to a conclusion. You compare your performance and then you propose the recommendation. These recommendation of changes are then implemented and you do a re-audit, and in this way the whole cycle is repeated. From here onwards I will give you a practical example of how you physically do an audit. The first thing is that you keep it very simple, keep it very short, and so that is doable and people agree to it. You never do it in isolation. You choose a common practice area, so everybody is well aware of the about what you're going to analyze, and also everybody is in agreement. You do your homework of finding what the current practices are and how can you see the difference between the practices and the set criteria. So once you have spotted the gap, you go back and do your homework. So in order to do your homework, you first thing is that you just make a spreadsheet of data collection. You need to know what facts you need to gather in order to put the information together and prove the evidence of what your data is about. After you have had a rough idea of what facts you want to work, you should know where these facts can be found. These facts should be found easily in the patient records or discharge letters, or how the record works in your hospital. So it also reflects that you choose only those areas which are adequately documented in the records. Otherwise you will have to struggle a lot at later stage. Now once you have made a rough idea of your plan, you go to your supervisor and discuss. It's important to know the supervisor who are keen on the audits and who are known to support the audit and take it to completion, because sometimes it happens is that your rotation is quite short and you need to come back and forth in order to complete the audit. Once you have presented your project to your supervisor, he should be able to tell you which forms you need to sign and where you need to get the forms approved, for example from clinical governance department or from various other places in your hospital. So now you have that form in physical, that paper in physical form. You have the topic of your audit, and you know what you want to gather in terms of data. Where do you want to store, where do you want to search this data, how many roughly people you would need to execute the plan, and then by the end of data gathering, how you will come to the conclusion. Now I'm taking you to a very, very common example of asthma. So asthma has a national guidelines which are called SIGN guideline number 33 for the primary care management of asthma. So you can go through these guidelines in detail, but for a quick review, I am showing you a few criteria against which you can, against each of which you can do clinical audit. And now let's see. For example, it says patients should be assessed at least once every 12 months. Patients should have a self-management plan. Patients should have had an assessment of their inhaler techniques within the past 12 months. Patient should receive immunization against influenza. Patient should have their peak flow rate recorded, should have their predicted PFR recorded, should have their best PFR recorded, should have their smoking status recorded, should have their current medication recorded, and also patients on reliever medication should not be prescribed beta blockers or NSAIDs. So the clever thing would be that you know all these standards, and you can find, first thing is be observable to see where the gaps lie. Also you should have an idea of if these gaps, are there any systematic way of recording these gaps. For example, is there any specific slot in your history, in your discharge slips, or in your clerking performer where these gaps are recorded. So that would be an important point to consider before starting your audit. Now once you have known that, for example, if you have picked smoking status for asthma, I think that's one of the easiest. Probably it would have been recorded. Now if you choose something which is very obviously recorded, probably you won't gain anything out of the audit because you want to show the gap. So be clever in choosing that. You need to know where the gaps are. So anyhow, moving ahead, once you have decided what part of the criteria you are auditing against, you plan your timeline. For example, you say 2 or 4 weeks of data collection. In order to collect the data, you should have a spreadsheet, and you should know which patient's record to go to search these findings. Now you have to delegate it to people, and then once you have gathered your result, you have to compare your results to the standard practices. So that's as simple as it is. I will show you further examples of what can be done in terms of further taking audits, and I will share a link of a very important document which explains many national and general NICE guideline audits which can be taken in everyday life. My message is that keep it simple, keep it easy, do your homework before going to a supervisor, and once you have reached to a supervisor, you should have a timeline in your head, and you should know your team and your tools where you will be using in order to gather the data. The rest is making the audit report, which differs between the trust. So you might be presented with some paper forms or PowerPoint presentation templates that you have to fit in these headings in order to present your data. Hopefully I should be able to make another video in order to explain how you present an audit in a report and give you an example as well. So that was all about it. I hope that this is helpful and you should be able to now understand these steps clearly and probably go in your practice, spot a gap, and then start your project. Thank you very much, and bye.